Hi everyone, Happy New Year. Hope you all had a great start to this fantastic new year. My apologies for the poor audio in my previous presentation. I thank you all very much for the constructive feedback and encouragement. To recapitulate, I discussed about headache. Headache is the commonest condition affecting mankind. Headache is the commonest neurological symptom, and there are more than 200 causes of headache. And isn't it amazing to note that brain per se does not have pain sensitive structures? That means, haven't you all? You can Google it. You can see a violinist playing violin, and at the same time, he or she is undergoing brain surgery. Isn't it amazing? So, the covering of the brain, the blood vessels supplying the brain, and the surrounding structures are the primary reasons for headache. And number 5, it is possible, very much possible, to have a normal MRI with an abnormal condition and vice versa. That means a normal MRI is not equal to a normal brain, and an abnormal brain is not equal to an abnormal MRI. Okay, so let's dwell deeper into migraine. So, what's migraine? So, migraine came from the Greek term hemicrania. Hemicrania means one side of the head. That, when translated in French, is called migraine. Initially, it was assumed that migraine is almost always unilateral. Now, it has been clearly shown that only 60% of the migraines are one sided and 40% can affect both the sides. So, what are the causes of migraine? What exactly is migraine and why does the individual develop migraine? See, migraine, as I said, is a very common disorder. It usually involves young adults, and women are more often affected than men. And the central reason responsible for this is the heightened sensitivity of pain structures inside the brain. So, have you all noticed? I'm sure more than 50% of you watching this video would have experienced migraine, and almost all of you would have noticed that during the height of migraine, the patients will prefer not to see any light. They would not like to like to be touched. They would not like any smell. They won't like to eat. So, which means that all the senses are hypersensitive. It's as though when just a pen is being dropped, it appears to them as though the whole building is crashing down. And the pain, when it occurs, it's throbbing. So, a migraine pain almost always starts gradually, builds up over hours, and it is associated with these symptoms like nausea, vomiting, inability to see lights, bright light, smell, and the usual symptom is once they vomit, they feel better, and once they sleep and get up, they feel better. So, this is in a nutshell about migraine symptoms. Now, another important thing we should know is the triggers. Again, most of you would have experienced, the patients with migraine, that there are usual classical triggers like exposure to bright lights, not having adequate sleep, not eating on time, emotional stress, and hormonal changes in women, especially a few days before periods. These are the usual precipitating factors, triggers. There are a few unusual, like food, example, chocolate, some people banana and cheese. So that doesn't mean that everybody with migraine should stop eating chocolate, banana, and cheese. So if can't eat chocolate, everybody likes chocolate. Why not? So it is only when people who have these triggers, they are the ones who should avoid. Otherwise, it's not a contraindication for eating this food. And another interesting feature is coffee. Excessive coffee worsens migraine. On the other hand, people who have migraine get relieved with caffeine. You would have heard, especially our parents or mothers or grandmothers who had migraine, they would say that you have coffee, your headache will go. Which is true. There are tablets containing caffeine which are useful in treating migraine. Now, having seen triggers, now let's come to investigation. So, many see with this background, it is very clear that the diagnosis of migraine rests entirely on the history of the patient, and on examination we should not find any abnormality. So, an imaging, the MRI of the brain, is not needed to make a diagnosis of headache, migraine. So, I don't usually ask for MRIs in migraine. However, there are many patients who come with the MRI and they have clear issue of migraine, and it's very difficult for them to understand that how come I have a very severe headache and my MRI is normal. So this is very common. We should understand this phenomenon and let's move forward. Now, having diagnosed migraine, how do we treat? Now, treatment involves three aspects. One is to avoid triggers. Second is to treat the symptoms. Third is to prevent further attacks. So we shall go one by one. So the most important thing is to make sure that food is taken on time and sleep is adequate. In fact, in many people who fast, and especially during the holy month of Ramadan, many people have this uh, worsening of migraine due to this improper sleep and due to the fasting. And as I said, as much as possible, it's not that these things should not be done. We should be aware of this. That's all. And we should our other triggering factors like exposure to undue high, very strong perfumes, and then exposure to very bright lights. And women have to be aware that a day before their periods, they are likely to get this migraine attack. Next, coming to treatment. It is amazing indeed to know that more than 50, in fact 60-70% of the patients respond extremely well just to a simple paracetamol and sometimes one medicine to prevent nausea and vomiting like domperidone. Okay, so but the key is this has to be taken at the onset. See, I also had migraine. Almost all patients with migraine will tell you that I am going to get migraine now and today my day is finished. So, at that time, if they take medicines, invariably they will do well. The problem comes when they wait for long and headache becomes very severe. In that situation, sometimes we will have to give some injections. So there are some other medicines also, like higher medicines, higher strong painkillers. It's a stepwise treatment. First is paracetamol, then higher painkiller, then there are specific treatments like triptans. The third aspect is prevent. See, not everybody needs preventive therapy if they to prevent further attacks. I mean, if the attacks are very infrequent, once in 2 months or something, just painkiller is enough. However, if the attacks are very severe or very frequent, usually a 6 months course of medication improves the patients very well. There are various categories of medicines which can be tried, and there are some of late there are some newer advances which are powerful medicines which can be given once a month, or there are some alternative therapies like transcranial magnetic stimulation, etc. They all work very well. So, having covered migraine to a fairly large extent, there are some special situations like migraine and pregnancy and migraine in children. We shall discuss about these aspects and a few more important points about migraine during my next video. Thank you. If you like it, please subscribe. Thank you very much.